Good morning everyone. Welcome to PG Pathshala. I am Dr. Pankaj Tandon from Atomic Energy Regulatory Board, Mumbai. The subject on which we are talking is biophysics, and the module on which we are discussing today is present principles of Spect. What is Spect? Spect is nothing but single photon emission computed tomography, and we are going to discuss about this particular topics and its principle in the next few slides. As we discussed, single photon means when we are doing the conventional nuclear medicine examination by using technetium, because technetium 99M is the workhorse of conventional nuclear medicine and it emits 140 kV photons. It is a single photon. Finally, emission computed tomography, because it is emitted from the body. Computed tomography word has come from because the camera takes the tomogram of the organ, it means slices of the organ, finally it reconstructs to give an image. It means SPECT is a medical imaging technique that is based on conventional nuclear medicine imaging and tomographic reconstruction method. The important thing which we should realize in case of SPECT or normal X-rays is, when normal X-rays are taken, what exactly happens? It takes the snap. When it takes the snap, it gives only two-dimensional images, but our organs are in 3D shapes. In order to take or in order to get the image of three-dimensional, when the function want to see it in all the directions, in order to know depth of that particular disease, SPECT is a very useful device. And by different reconstruction techniques, you are going to get an image. The image reflect functional information about patients. We know it. This SPECT is different from X-rays or CTs or MRI. CT, MRI, X-rays give anatomical picture, but SPECT, which is a modality being used in nuclear medicine, gives the functional as well as anatomical both. When we know the functional information, doctor can able to formulate the regime how the patient is to be treated. Very, very important. Until and unless you know the location, until and unless you know the function, because if you see the kidneys by any other method, you can able to see it. But when you see the ejection fraction, you can able to find out, okay, this kidney, one right kidney is functioning more better than left kidney, and then accordingly the treatment can be planned. SPECT gives information based on the spatial concentration of injected radiopharmaceutical, in contrast to other medical imaging modalities used for clinical diagnostic purposes. We are emphasizing more and more that this particular gives spatial concentration. It means all different directions. It may so happen, if you see the lung, if you want to scan the lung, you see that one particular point is a hot spot. If you want to see the kidneys, you can find it is functioning 70%. One kidney is functioning 7%, other kidney is functioning 60%. Heart, how the viability of the muscles, that all being done by using nuclear medicine and by using Spec Camera. Now, when we talk about planar images, that is 2D, X-ray or gamma camera, which was the earlier used modality in comparison with Spect, which gives a 3D, because the camera is rotating all around the patient, taking the tomograph, by using reconstruction technique, you are creating an image. What are the advantage of tomography images? You take an apple, you cut in different slices, you can able to know which particular slice is having a problem, or where that particular slice is having some issues. When you reconstruct back, you get an apple back. It is the same principle being followed in case of tomography images. A basic problem in conventional radionuclide imaging is that the images obtained are 2D projection of 3D source distributions. You know, all organs are in 3D shapes. Now, if I want to take an image in two-dimensional way, what will happen? You get only image in a XY form, but 3D means in the Z, the particular depth at which the problem is there. That what's the advantage of tomographic images. Images are structured at one depth in the patient, thus are obscured by the superposed image overlying underlying structures. Now, what will happen? Let us suppose I keep the camera in front of the body, the patient is lying on the couch and the radiation is being emitted from, or photons are coming out from that particular organ. What does the detector does? Detector takes an image. Like an X-ray, it takes a shot, it takes an image. But what will happen if the disease at certain depth, the radiation or emission which is taking place from that particular organ is being obscured, being attenuated because of some overlying structures, you cannot able to really get the good quality image. And if the quality of the image is not good, doctor cannot able to decide the treatment regime. One solution is to obtain tomography image. That is the reason we thought, okay, why don't we rotate the camera all around the patient at different degrees in different time frames, collect the images, reconstruct it and make a 3D image. Tomography images are capable of providing more accurate quantities of activity at specific location within the body. That is why Spect is more popular than a gamma camera without Spect. Tomography images we are talking about, and I already mentioned what does tomos means. Tomo in a Greek word is for cut or section. As I explained in a very simple way, you take an apple, cut in different slices, each slice is one tomogram. Modern computed tomography CT techniques including positron emission tomography or single photon emission computed tomography and X-ray CT using detector system rotated around the object so that many different angular views can be taken, and finally by using reconstruction technique you can able to get the image in three-dimensional form. What does it mean? It requires a mathematical algorithm. It is not a simple task when you are going to rotate the camera all around it and capture the image, when you are going to do the acquisition of the images. Finally, you have to do what? You have to really process those images. When you are doing the process of the images, you require some kind of algorithms. Finally, mathematical computations, some techniques are required, some formulas have to be written, some programs have to be written, and really that only makes reconstruction techniques and give the images in a 3D mode. Reconstruction of images from multiple projection of the detected emission from radionuclide within the body is known as emission computed tomography. We are not talking about attenuation, we are not talking about transmission, we are talking emission word, because radionuclide or radiopharmaceutical I should say, when injected or administered in the human body, goes to the particular organ, it emits radiation. You are going to generate tomographic images, and that is why it is called emission computed tomography. What is Spect? I think by this time I am able to explain you Spect, but we should know Spect is a short form of single photon emission computed tomography. As its name suggests, gamma rays are the sources of information rather than X-rays emission in conventional CT scans. CT scans give X-rays where gamma rays are coming out. Both are having photons, but the origin is different. Why Spect is required? When we have other modalities available in our country like X-rays, like CT, MRI, why we need an Spect? Because Spect allows us to visualize functional information about patient specific organ or body system. That is why Spect is required. Otherwise, you can get the examination done by CT or MRI or X-ray, anything. But we are not worried about anatomical picture. We want to know the disease, how the organ is functioning, because some of the disease which has not been detected by other modalities, Spect and PET can able to do that. The Spect is one of the major, most important modality being used in nuclear medicine for the functional purposes, and as well as anatomical also. When we see the theory and instrumentation of Spect, Spect is a technology used in nuclear medicine where the patient is injected with radiopharmaceutical which emit gamma rays. We are talking about Spect, single photon, it means technetium. Technetium is the workhorse, which means 140 keV gamma rays. We seek the position and concentration of radionuclide distribution by the rotation of photon detector array around the body, which acquires data from multiple angles. What does it mean? You are basically rotating the device all around the patient and and basically acquiring the photon which is coming out from the patient and then creating an image. Each of the cameras collect a matrix of values which corresponds to number of gamma counts detected in that direction at one angle. Images can be reprojected into three-dimensional one that can be viewed in a dynamic rotating format on a computer monitor, facilitating the demonstration of pertinent finding to the referring physician. It is the most important point that if you can able to detect the disease, or if you can able to get the images, or if you can know the function of the organs at certain depth, physicians have a challenge. They can able to treat you much better way. As started retinal scanner, then came gamma camera. We are talking about retinal scanner, we are talking about gamma camera. Gamma camera is an instrument which utilize many components like camera, collimator, scintillation detectors, photomultiplier tube, positron circuitry, data analysis computer. What does happen? A patient who has been administered radiopharmaceutical is emitting some kind of radiations. What it does? It comes to the collimator. What is the function of collimator? The function of collimator is to see to it that only those radiation which is coming parallel in hole or pinhole collimator or diverging collimator or converging collimator, that only goes to the detector. Detector is nothing but sodium iodide thalamoactive crystal. It impinges on detectors, and what will happen? A light photon comes out. This light photons comes out, and finally it comes from a PM tube where electrons being generated, and because positron circuitry, after the thing we have a computer where the analysis is done and you get a quality image. This is a very pictorial graph of the Spect, and you can able to see that the detector is rotating all around the patient, and this is the second generation. Initially we used to get the images in two-dimensional board, but when it rotates around the body you get the image in three-dimensional board. But again, imaging is not that simple like in X-rays, but here like in CTs or MRI you require some kind of softwares. Here we require some kind of softwares, algorithms to generate the images in three-dimensional board. But the advantage is that in this kind of thing you are not getting in two-dimensional image, you are getting three-dimensional image, and moreover you are getting the functional information about the organ. Single photon emission computed tomography acquire multiple planar views of the radioactivity in an organ. I am keep on emphasizing this particular point. You are getting the multiple views of the radioactivity. Take an organ, take an image, rotate the camera, take other image, rotate the camera, take other image, in which you are basically rotating the cameras all around the body and taking the image. The sequential planar views acquired during tomographic acquisition are called projection views. What exactly was projection views? The photons are being emitted, it is directly going, hitting the target, that is the detector, detectors, electrons, PM tubes, final circuitry, and getting the image. You are getting one projection view. You have to get the projection view all around it. Once you get the projection all around it, from algorithms you can able to construct the organ in three-dimensional way. The data are then processed mathematically to create cross-sectional views of the organ. Spect utilizes a single photon emission by gamma emitting radionuclides, this is technetium, gallium, indium, and iodine 123. Most of these isotopes are having single photons, but they have other photons. But as I said to you, technetium 99 is the workhorse because it is giving 140 keV photon, which is a monoenergetic. This is in contrast to the positron emission tomography, which utilize pair 511 K2 photons. PET uses the radioisotope which is positron emitter. What does positron does? Positron comes out, hits the electron, annihilation takes place, two photons are coming in two different directions, opposite to each other in 180 degree and of 511 keV, and finally the mechanism is same, it goes and hits the detector. But detector in case of PET is different than SPECT, which we are going to cover up in next presentation about PET. The simplest camera design for SPECT imaging is similar to that of planar camera, but with two additional features. What does it mean? It means to say Initially we came with a retinal scanner, then came with gamma camera, and gamma camera with kind of motion is called Spect. We are having a CT also. First is the Spec camera is constructed so that head can rotate either stepwise or continuously about the patient to acquire multiple views. Our main objective is not to get 2D image. Our objective is to get the 3D image of the organ which is in 3D in shape. Second, it is equipped with a computer that integrates the multiple images to produce the cross-sectional view of the organ. Reason is when the image is being constructed by using different kind of reconstruction techniques. What does it? You can able to see the organ is moving. You can able to see the heart movement, how the heart is moving, what is the ejection fraction, what is the viability, where is the hot spot. Everything you can come to know by this. So, they are having two mechanisms. First and second is, first is acquiring and finally processing the image using computer or reconstruction techniques. The more advanced Spect camera designs have more than one head or are constructed with a ring of detectors. Now, what does it mean? Initially the gamma camera, when we talk about, we have the gamma camera having a detector who can take the images from one angle, anterior, posterior, right lateral, left lateral. But Spect camera is more advanced. They can able to rotate in particular way, or now we have cameras where ring of detectors is there when we talk about CT or PET CTs and all. In the case of single and multiple head cameras, the head are mechanically rotated around the patient to obtain the multiple projection views. What does it mean? We have two heads, we have a 3-head camera, the camera rotated all around it, the photon which is being emitted is going to be captured by detector and you can create an image. It means the detector moves either stepwise or continuously around the patient to acquire the photon which is being emitted and then construct the image. Ring detectors have a ring of individual small crystals or a single donut shaped crystal that does not rotate. What do you mean by ring detectors? They have a single individual small crystals or a single crystal, donut shaped crystal that does not rotate. It means detectors are not rotating. It is in the form of ring. Detectors are all around it. Detector is not rotating, but you are able to detect from all angles the emission which is taking place from the patient body. This is a type of camera as I shown you previously where the detector is moving all around it, but here you see the crystal is in ring shaped. It means what exactly is happening? What is the advantage of this kind of thing is that within less time you can able to detect all around it, all around the emission which is taking place in the patient body. This is a single donut shaped crystal, means you can able to see ring where the crystal is there and the emission which is taken place being detected by the detectors and finally you can able to get the image all around it. Now comes Spect, which is a single photon emission computed tomography, angle of rotation. Single headed camera must rotate a full 360 degree to obtain all necessary views of most organs. In contrast, each head of a double headed camera need rotate only half as far 180 degree and a triple head camera only 120 degree to obtain the same views. What does it means whether a single head camera is there or a dual head camera is there or a triple head camera is there, only to acquire the images from different angle. What single head has to do? Single has to move all around the patient in 360 degree and keep on taking the images from all around it. What the dual head does? Mostly most of the cameras which are available in our country is dual head. It has to rotate 180 degree. But if you have triple head, what does it mean? There are 3 heads are there. It has to rotate only 120 degree to cover the 360 degree. The cost of additional head must be balanced against the benefit of increased speed of acquisition. Really what exactly happens if you have a single head, you can able to get the image, but you have to keep rotating the cameras all around the patient. You miss some kind of information, which is the advantage you can have in dual head camera. Dual head camera has to rotate 180 degree, triple head 120 degree. It does not mean that 120 degree camera is going to be much more advantage than dual head camera. So, always to have a dual head camera, because triple head camera, though the angle of rotation is 120 degree each, but it is not going to have much advantage over the dual head camera. So that's why it has been clearly mentioned that in order to have an additional head, we must balance what benefits really we are going to have in case of acquisition is concerned. Now this is a triple head camera. As I showed you a dual head camera in the previous presentation, I showed you a single gantry also, donut typed. Angle of rotation you see, each detector has to rotate 120 degree to complete the 360 degree rotation. This is again a Spect. Arc acquisition, what does it mean? Basically our job, our objective is to get the images all around it. Tomography projection views are most often acquired over an arc of 360 or 180 degree, because when we want to say the image is anterior posterior, it is fine, but really we want to see the organ which is 3 dimensional certain depth, then really we have to go for 360 degree. The 360 degree arc or 360 arc of rotation of camera heads is regularly used for most organs. The 180 degree arc is used for organs that are positioned on one side of the body, such as heart. You can able to see it, you do not require a 360 degree, because by a 180 degree you can able to see the heart at two different directions. And views of the heart are obtained in a 180 degree arc extending from right anterior oblique position to a left posterior oblique position. It means to say, if at all you want to see the heart, you really do not require the camera to rotate all around the body and take a 360 degree arc of rotation, but 180 degree can do it. But for information, there are new different kind of cameras are available that is categorically mentioned for heart, because the detector is very good and it is going to give a good quality image as far as heart, the images of heart is concerned. But this presentation or this particular slide text about it is not necessary every time you should have a 360 degree rotation in order to get a quality image. Now again, when we talk about arc acquisition, the data from this 180 degree is considered adequate, because you can able to see, as I mentioned in my previous slide, that some of the organs which are there in the body at one particular which are there in one particular place, no need to have a 360 degree. The 180 degree itself is quite good enough. But again, it totally depends the time constraint and the time, if at all really the physician wants to see some other deformities or some other information about that particular organ, which you can able to see in 180 degree, you can have to rotate in 360 degree to get the 3-dimensional view and able to find out which particular muscle or which particular organ is giving some kind of deformities or some kind of abnormalities. Now comes to single photon emission computed tomography. Again, the number of projection tomography image, as we were talking about 360 degree, 180 degree, the slices now, because detector is moving all around it, and now we have detectors or CT which are 64 slices or 128 slices, and similarly 32 slices. So over a full 360 degree arc, 64 or 128 tomography projections are usually collected. Similarly, 32 or 64 views are generally obtained over a 180 degree arc. It means to say taking the slices is very important, because it is coupled with CT. So it is not only giving the picture of functional, but in order to have an anatomy, because finally we have to fuse these two images. And Spect CT, when we talk about the CT part, when it comes, single photon emission computed tomography is basically making the image, you can say the functional images. But in order to know the real depth of the disease, you require a CT part to be included. That's why called hybrid Spec CT. And in such case, what exactly happens? The anatomy and the function images are to be fused to get a good quality image, and so that physician can able to decide which is the location where the disease is there. So hybrid technology nowadays are playing very important role. Now collection time is very important. As I told, for a given dose of radiopharmaceutical, better images are generated using the higher counting statistics from longer acquisition. Our patient comfort and cooperations limit imaging times acquisition times of 20 to 40 seconds per projection views are standard. What does it actually means to say that you have injected an activity and the activity has gone to the patient. Now that depends after few hours. It may so happen you have to take a delayed images, or it may happen that you have to take a dynamic images. When the activity has gone inside the body, definitely emission starts. But we have to see to it when the activity is in the blood pool and when it is going to the organ of the choice. So the acquisition time is also very, very important, but we have to see the patient comfort also, when the patient is on the couch, how we can make him comfortable. That is again the two important aspect has to be seen to it. Sometimes the protocol says that that the patient has to be there for this much of time, for this much of activities to be administered. But again, acquisition and activity depends on many factors, like a patient who is a child patient, pediatric patient, or who is a bulky patient, in such kind of how much activities to be administered. And when you are doing, when you are taking the scan, you feel that sometimes acquisition time is less or acquisition time is more, because for construction of the images you require some kind of counts. What is counts? Counts is nothing but a number of photons which is being emitted. And until unless you get that much of counts, the activity, or you can say the image is not going to be good quality image. So the two important parameters which has to be seen to it, are the protocols which has already been fed in the computers, this particular scan takes this much of time and this much activity to be given. Because for a good quality image, it is not required that you give a less activity and keep acquiring the image for longer time, because finally your objective is to get number of counts, because number of counts is only going to give the image to you, because when the projection data is collected and different algorithms are to be used, because there are some kind of random counts are there, some kind of attenuation is there, those corrections are to be done. So we require a certain substantial amount of counts to make a data. But it does not mean that you give a less activity and keep on acquiring by the time the patient moves, because the patient is not comfortable on the couch for longer time. And it is not advisable also that because the patient is not comfortable and you want to finish the scan in lesser time, give a larger activity. Because what happens usually, instead of X quantity, you are giving Y quantity, you are doubling the dose, and because you want to finish, you want to take more quantity. Because what exactly is happening in such cases, you are basically giving more dose to the patient, because no, the quality of the images is there, but you are unnecessarily giving the dose to the patient to get the images. So this is basically a very, very important, that how much activity to be given and for how long this acquisition is to be done to get a good quality, because our objective is that the scan should be finished in minimum time with a minimum time with less activity, and it should not be so happen ki while doing so we are missing the information. And that is why the reason is quality assurance or QA plays a very, very important role, because sometimes it is observed that you are basically taking the image of a camera where some of the PM tubes are not functioning. What exactly happened? If some of the PM tubes are not functioning and the gain is not there, or they are not sensitive, or they have been deteriorated because of time span, then what exactly is happening is you are basically trying to give more activity to get counts, which has not been getting with some of the PM tubes. So you are administering the activity and you are giving more dose to that particular organ. See, whenever the medical examination is taking place, we know there are no limits for medical exposure, but it does not mean you are going to give more activity to the patient and to get the scan done. So optimization is to be done in a very, very systematical and very, very in a manner, so that the quality, you get a good quality by giving less dose and a less time and less comfort and good quality image. What are the advantages as we are talking for Spect by this time, that localization of defect is more precise and more clearly seen by inexperienced eye. What does it mean? Inexperienced eye does not mean any doctor can able to see it, but yeah, If a doctor is having certain kind of experience, he can able to find out, okay, this is the place where there is a hot spot, where this kind of abnormalities, that has to be seen. And extent and size of defect is better defined, because if at all you can able to, if you are able to see the image, and you can able to find, you can able to resolve that image, you can able to say that, okay, this is the place where the disease is there, and doctors can able to decide the future course of action. Images free of background, which is one of the most important thing. Free of background, what does it mean, and what is the advantage it is having during the scanning purpose? Because if you are going to take the scan at a place where the background radiation is very high, then what will happen? It is going to disrupt your images. Similarly, if any already contamination has taken place at some point, whether it is on detector, whether it is on the couch, and when you are taking the image, you find some kind of, some kind of hot spot over there, and you say that the patient is having some problem. The disease is the patient, but no, it is not like that. It is disease with the, it is the contamination problem. It is the problem in the couch or maybe some detector. So we have to really see to it what are the advantages over there, but we have to look into it, what are the disadvantages it can have because of contamination problems, or because of some kind of QA problems, which is one of the most important thing we have to see to it. Now we know how the Spect functions, and there are a few examples we can see where the imaging is being done, like heart imaging. If you want to see the functioning of the heart, like viability studies or myocardial infarct is there, how much heart is functioning. There are rest studies and stress studies being done on how much your heart can take the load. So it is one of the major application in case of heart imaging. Similarly, brain imaging, when we talk about, if some of the brain part is not functioning properly, and either you get to go for MRI, but MRI gives some kind of image to you, no doubt about it. But if you really want to see what exactly is the problem which you cannot able to detect from the MRI, then I think Spect is referred, because at that time the radiopharmaceutical being used to go to the brain, and from there you can able to find out which part is having a problem, or whether some tumor is there which required surgeries and all those things. Because Spect, as I told you, MRI gives the image to you in an anatomical way. But you want to know function, and function is able to find out from nuclear medicine, and Spect is one of the good modality to do that. Whole body imaging. It may so happen some part of your body, like bones and all those things, we do not know, because you have done the bone scan done, and you find out some kind of BMDs and all those things by other kind of modalities, there is some kind of density changes. But if you really want to see it, which particular part of the you can say in the whole body the problem is there in the bones and all those things, that particular Spect plays a very, very important role. Now comes to the tumor detection. As I referred, nowadays tumor detection is very, very important thing. Suppose in oncology, the patient has been diagnosed with a cancer, a tumor, in very early stages, and which is possible in case of by Spect only, because MRI could not able to find. MRI found that there is a problem, but really Spect you can able to do the function, you can able to find the depth, location, and by using Spec CTs, and you can able to really find a good quality image. Then when the tumor is detected, and either the surgery is done, or chemotherapy is given, or radiation is given, then you really wants to see how the progression takes place, whether the tumor which has been detected has been treated, or some kind of further examinations or further treatment is required. So Spect plays a very, very important role. Bone scans, because sometimes you have problem in the bones and all those things, and you are feeling tired, you are taking the medicines, but there are certain reasons that the bone deformities are there, or some kind of you can say mets are there in the bones, because it has been seen that when the tumor has been detected at one particular location, you find mets in certain other places, like spine, like other bones and all those things. So there Spect plays a very, very important role to see to it after treatment, or before the treatment, or during bone scans, if any problem is there or not. In summary, we should say that Spect single photon emission computed tomography being a nuclear medicine imaging modality, it has all the advantages and disadvantages of nuclear medicine and can be highly beneficial or dangerous on the application. So is Spect. Why even say disadvantages? When we talk about radioactivity, if you are not using properly, if some kind of misadministration is taking place, but it's more very advantageous. In spite of this, today, nearly all cardiac patient receives planar ECT or Spect as part of the workup to detect and stage coronary artery disease. No doubt the gold standard as far as heart is concerned is angiography. The cardiologists feel that angiography is a gold standard to find out the functioning of the heart. But if you really see nuclear medicine, where without non-invasive you can able to find without putting the catheter and all those things, you can just give thallium or technetium-99m, maybe or Mahaview, you can able to find a heart is functioning and then you can able to treat it. So, if you see that nuclear medicine, Spect is playing a very important role as far as functioning and anatomical images are concerned. And in today's world, I think nuclear medicine is one of the very important modalities, and without invasive procedure, non-invasively you can able to detect the disease at an early stage and you can able to treat it. So, Spect is one of the most important thing. With this, thank you very much.